Hence, KS Health Awareness. KS Health Awareness is a 1-hour health program designed with you in mind to guide and provide you with important educational health tips. Established on Kingdom principles, KS is a free online laboratory institution with seasoned health professionals willing to impart knowledge free of charge. Tuning every first and third Fridays in the month to Sky FM 107.1 from 6 o'clock to 7 o'clock in the evening, with a repeat on the following Sunday from 10:15 to 11:15 in the morning. KS Health Awareness, activating the next generation of innovative scientists by increasing health knowledge. Don't miss it.
Hello from the other side.
When people are aware of their health issues, they become more encouraged to take action and remedy the illness or seek help. The Kingdom Innovation School of Science, in collaboration with Blessed Kids International, presents KS Health Awareness. KS Health Awareness is a 1-hour health program designed with you in mind to guide and provide you with important educational health tips. Established on Kingdom principles, KS is a free online laboratory institution with seasoned health professionals willing to impart knowledge free of charge. Tuning every first and third Fridays in the month to Sky FM 107.1 from 6 o'clock to 7 o'clock in the evening, with a repeat on the following Sunday from 10:15 to 11:15 in the morning. KS Health Awareness, activating the next generation of innovative scientists by increasing health knowledge. Don't miss it.
Hello from me.
Good evening and a pleasant welcome to another interesting edition of the program KS Health Awareness on Sky 107.1. We are here every first and third Fridays in a month here on Sky from 6 to 7 o'clock. Today is the first day of July 2022. My name is Matthias Labindi. On the program today, we're looking at the effect of COVID-19 on society and education. What is it that what is the effect of this pandemic on society and education in general? As always, our panelists are professional people. This program, Case of Awareness is brought to you by the Kingdom Innovation School of Science in collaboration with Blessed Kids International, a very school building foundation for our young kids who are poised to be leaders of this society tomorrow. And live in the studio is Pastor Kamara. Pastor Kamara is the proprietor of the Blessed Kids International. And on the line from the US, we're going to be joined by three of our distinct panelists, as always, Dr. G. Boakai Passaway, as well as Mr. Daniel Atto and Dr. Mary Brookfield. The three are going to be joining us via Zoom to tell us more about the effect of COVID-19 on society as well as education. But right now we have in the studio Pastor Kamara. My name is Matthias. I'm going to take a break. When I come back, I'm going to start the conversation with Pastor Kamara while the other panelists join via Zoom. You're listening to KS Health Awareness on Sky 107.20. The repeat of this program comes on this Sunday from 10:15 to 11:15. You don't want to miss it. We'll be right back. That's right. Welcome back to the program. Case of Awareness on Sky 107.1. Case of Awareness is brought to you by the Kingdom Innovation School of Science in collaboration with Blessed Kids International. We are here every first and third Fridays in the month from 6 to 7 o'clock. Today we are looking at the effect of COVID-19 on society and education. Interestingly, we have an educator in the studio who's going to discuss the aspect of education as well as maybe touch other health issues, because of course all of us, we are consumers of the health sector. So when the health sector is affected, whether you are in the education area or not, you also feel the impact of the health sector. But our panelists, who are doctors, medical practitioners, they're going to be joining us online shortly, so they can weigh in on this important topic. You two are valuable listeners following us via the radio on Sky 107.1. We're going to open the lines shortly. That is halfway marking the conversation to hear from you. But better still, you can follow us on Sky Communications Liberia Facebook page, where we are streaming it live so that you can participate as well there by dropping your comments. We're going to read them out as well if we see your comments, so you don't want to miss it. Let's hear you quickly. Pastor Kamara, it's a pleasure. Welcome back. We've had several breaks in between due to some unforeseen circumstances, ranging from break from our end, and other issues. But welcome is good coming back together again as a family to discuss, pertinent issues about health, matters in the country. Welcome, sir.
Thank you, my friend.
It's a pleasure. How's the school going?
Great. We just preparing now to close for the year.
Okay.
Our whole program will be coming to our end July 23rd.
Okay, so you run a preparatory school,
Correct.
all right, kindergarten school to say, nursery school,
Early learning.
early learning school. So that's preparatory. So, when we talk about COVID, just to ask you a general question initially, when you talk about COVID, what comes to mind? When you hear someone mention COVID, what comes to mind?
Well, the thing that comes to my mind when we talk about COVID is it's my own experience that kind of give me the alertness, because I was diagnosed with COVID myself and it was really devastating. It is a very, very I don't know how to call it, but it was a scary time for me. It's a very disruptive disease, if you will, pandemic. When I was in the U.S., when you contact COVID, you don't go to work, you stay home for 2 weeks, and that was very hard for me, and so coming back into the educational arena, when we talk about COVID, even though the medical practitioners and those who are in the medical field told us that children are not really affected much than the older people like my age group. Okay, but here is what happens when COVID strike all of the globe. It prevents the kids from exercising their educational rights. They don't have the normal classes. most of them was having what we call take-home assignments and what have you. They stay home. Homeschooling was a part of the program for kids during the COVID pandemic era. So it's a very disruptive virus. You know, it causes a lot of problems for the smooth running of any institution. Like our institution, this is our first graduation. Our school was founded in 2019. You imagine, right? You know, the year that COVID-19 when COVID-19 hit the global world. So we were in the center. So we closed that year. We were not able to complete the school year. We were also not able to complete the following school year. So now we are privileged to have this year, hopefully, by the grace of God, we will be having our first graduation.
Okay, so you know, I think I don't know what the conversation I can look here as a post-COVID conversation, but that can only be said when we discover that COVID is no longer in Liberia. When we find out the status of COVID in the country, which I'm waiting for the doctors to get on so they can tell us. But you generally talking about the effect COVID has on education. It affected your school so much so that you had to close temporarily. You know, abruptly close your school, and now you're having your first grad. This should have been your second graduation.
Correct.
If I may.
By the way, tier
graduation. Yeah. Right. Because you started since 2019 to now, it should have been your tier graduation, but that affected it. But learning in general, that new model of learning, how were the kids navigating through that process of taking lessons home? Parents are busy. It's because people are busy. That's why maybe they look at their 2-year-old, 3-year-old children and send them to school. But now you're sending such a child home with the lesson. They take you home, let your mom and dad teach you. Some people don't have patience to teach their children. What are some of the things you were getting, some information you were getting from parents, as well as you as school administrator, the interaction you were having with the people, you know, some of the things they were saying, well, this is difficult, this is hard, this is, just tell me, just run me through, you know, the interaction you were having with parents whenever you send the kids to the notes.
I would tell you right from the get-go that it was very, very tough for the parents. And not only for the parents, but it was also tough for the kids. You know, there's this psychology of learning about kids. They learn better, they interact better, they associate better, they do everything better when they are in group, when they are with their peer groups in class, say for example. Okay, if you take them away from that environment and take them back home and you try to instill learning, you know, exercises and try to introduce them to some learning principles and go through some rigid learning protocol, if you will. They see it as something foreign because at home they feel that they should be loved by their dad at home. They should be fed. They should go to bed. They should get up and just play at home. Now the home become
a school
for them. So that's a whole new experience for them. That's a tough call for the kids, and that was what was happening during the COVID era.
And do you think that many of them really grabbed some of the lessons you shared with them to take home because of the change of their learning location?
Yeah. Exactly. I mean, no, I would say no. Some of them were kind of left behind. Let me give you this example that I've experienced hands-on about this COVID interruption, or disruption of our educational system. When the kids were homeschooled, if you will, what happened was that they were not being evaluated in the normal setting, school setting. So the parents were not trained to evaluate them, to carry on these educational exercises.
Right.
So what happened was that they were not paying the attention that they needed to,
Right.
if they were in the classroom. So what happened when they came back to school? So they fell behind. Their attention span.
They came back to a new environment.
Yes.
An environment that they were in, and they were taken from that environment and sent back to a home environment, which became new to them because the home environment became a school environment for them.
Correct.
During the COVID.
Correct.
Let me hear you a little bit and inform the public that yes, our panelists have joined us. We have Dr. Mari Brookfield is on. Dr. G. Boakai Passaway is on. Mr. Daniel Arthur is also on, and the three are there. Let me just get it on quickly. Let me say welcome, good morning, good evening from your end. I don't know what's the time there, but good morning, good evening. It's evening time here. Dr. Mari, good morning, good evening from my end.
Good morning.
Hi.
Right.
Good to see you.
Right. Dr. Passaway, welcome.
Good to see you.
Thank you, Matthias. As always, we really appreciate you.
Right.
Thanks for that.
Right, Mr. Arthur.
Always really appreciate you.
Yeah, thanks.
Right. Go. Let me get it going quickly.
Good to be here.
Right. It's good to be here always. We've been missing each other for a very long time. We've not had much conversation. Bobby, you need to check that. I'm getting some kind of vibration from the background, from their end. I don't know whether the mics have been touched by something else. You need to check it. But let me quickly hit. Let me get to the first question here. Dr. Mari, you quickly give us the status of COVID-19 right now in the world. If you have information about Liberia, you can also add that. Is COVID-19 still a threat? Is COVID-19 still a threat to the world, or as well as some other underdeveloped nations like Liberia?
Well, COVID is increasing in the world. So far, we have had 546 million cases of COVID in the world, and that by about 1 million cases every day. We have had 6.3 million deaths, and that increases by several thousand every day. In Liberia, the official totals are 7,493 cases, so about 7,500, and less than 300 deaths. But I think some of that is because the country has not done widespread testing and reporting. Because I am aware of a flight that was supposed to depart a couple of weeks ago from Liberia, and everyone has to take a test to get on the airplane.
Right.
And you go through this questionnaire. Have you been exposed to anyone? Are you having any of these symptoms? And the answer is all like no, 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 no. And then you take the test. 30 people did not get on that plane. They had no symptoms, but they had COVID nevertheless. So honestly, I think Liberia has been blessed to have very minimal impact compared to other countries in the world. And vaccination-wise, we're doing okay. In the world, more than 12 billion doses have been given. Fully vaccinated, about 62%. But in Liberia, only about 28% are fully vaccinated. And I think a lot of that is because there's still all this gossip and all these rumors that, oh, you won't be able to have children if you take the vaccine, or, oh, something's going to happen years later. And I can tell you in the history of vaccines, and it is possible to have an adverse event from a vaccine, but it's not possible to take the vaccine and you feel lousy for a couple of days and then you get better. And then suddenly 6 months later, 1 year later, 2 years later, something happens. That is not possible.
So what I want to get quickly is that I asked also is a double question here. I mentioned to try to find out if the status of COVID in the world, whether it's still a threat. Let's compare the threat that COVID posed to us initially when it just came, when it was spotting in so many areas of the world, is that threat still the same, or it has declined to a certain extent, based on interventions that have been made?
We do have some interventions, but actually we are having more cases, more new cases every day now than ever before.
How do we identify those cases? Because it seems we're just living our normal lives now. I don't know about the United States. I don't know about other countries, but like Liberia, except I usually use a nose mask for a purpose. And that purpose is maybe when I'm riding a motorcycle, I don't want to catch cold too much. I put my nose mask on.
Sure.
When I'm going to the bank, I use the nose.
You should wear the nose mask in the taxi.
Yeah, in a taxi as well. Yes, I do that, because I'm getting in the midst of people, but I don't see the observance of these basic protocols that were put, in place by the government, for COVID. Is it that we now relaxing on it because the threat has declined?
Well, as I said, the cases are higher than ever before, but many people, COVID is changing inside people's bodies. And that's why we talked about vaccines so strongly for so long, is if you can keep the virus out of a body, then it cannot change.
All right.
Once it gets in a body, it can mutate to a different form. And so that's what we're seeing is more and more different variants of COVID. My oldest daughter now has had COVID 2 times, and each time her symptoms were different. Now she's having what people might call long COVID here, where she's so tired. She's so tired. And she's very short of breath if she wants to go walking or hiking. Whereas the first time she had COVID, she could not taste anything for more than 6 months. But she has been vaccinated, so she's alive. And that's the point of the vaccination, is to keep people alive.
And the vaccine,
as you know,
are the
my
vaccines?
one son that did not get vaccinated did die from COVID. And he was a young, healthy, active firefighter, but he refused the vaccine and he died from COVID.
Are the vaccines effective?
Well, they're effective in keeping you alive. They will not stop you from getting COVID, but they are very likely to stop you from dying from COVID. Your chance of dying from COVID, if you've had the vaccine, is 1 in 10,000. Your chance of dying from COVID, at least with the first round of COVID, was 1 in 57 if you did not have the vaccine.
All right.
It seems like the variety of COVID that we have now seems to be less deadly. So that's a blessing.
Let me hear from you, Mr. Arthur, quickly. I want to find out whether there has been effective treatments, developed by the World Health Organization or other medical organizations around the world, or medical institutions, so to speak, regarding this COVID-19, situation in the world. Have there been effective treatments, developed?
Thank you, Matthias. That is a good question. There have been some clinical trials with experimental drugs, but it's not something that has been approved yet for the general public. So our best bet now is the vaccine, as Dr. Marie has told you, because the vaccine helps us not to die from COVID. The vaccine prepared our body, our immune system, to get rid of the COVID. So people who have not taken the vaccine probably will eventually die from the virus. So that is the answer. Yes, experimental drugs are there, but it hasn't been approved.
Would you
for
like
general
to
public.
Right, quickly, let me just hold you a bit and bring in Dr. Passaway so that we can play around the 3 questions first before we move on to another one. Dr. Passaway, would you go to recap a bit, if you may, just to touch a bit about the current status of COVID-19, whether it's still a threat to the world, or better still, you can also weigh in the effectiveness of the vaccines that have been produced by the world and people that have been are taking them.
Thanks a lot. I think Dr. Marie and Arthur did an excellent job talking about the impact. The virus, the impact is felt across the spectrum. No, as an institution, it's felt it across the economy. Dr. Pastor Kamara spoke about the impact on health sectors, and it goes on. Now, I think what has happened because of the vaccine, there was a lot of emphasis in place on the vaccine is effective. What it's done, the cases are still there, but it has lowered the severity for those who are vaccinated. It does not say you're not getting a vaccine. For me, I'm fully vaccinated. I've got it twice. You know, I've got it twice.
You've gotten the COVID twice.
The severity is realist. Honestly, you can survive it. So because of all that conspiracy, it doesn't say the vaccine does not prevent. What it does is lower the severity of the signs and symptoms. So it better your chances of survival. So the disease is still there, the infection is still there, but because of the vaccine, we're not seeing the number of deaths, but the threat is still there. Now, secondly, because we know about the mode of transmission, it's very important, the infection control cycle. Because the public health expert has a grip on that. So now they are introducing mitigating circumstances, like washing your hands, wearing your mask. All those lower the chances of getting infection. But as Dr. Marie said, the threat is still there. It is still there. The cases are going up, but it's just that we're not seeing the death because of the vaccine.
Let's look at the health impacts, that COVID has caused on the world. Would you quickly touch that? You and Dr. Marie can play with that, but let me hear from you first, Dr. Passaway. What are health impacts has COVID, had on the world in general?
Oh, the impact is really, really. If you look, first of all, we look at death tolls, right? That Marie touched on that. I think it was 6-point-something percent of people that died. That affect the workforce. In that number of deaths, you have people that educated people, experts. So the first thing you look at that. If you look at mental health, because of COVID, people could not go out. People were all in one place. Even domestic violence was on an increase. You look at sexual transmitted diseases among young people. They found that that was also on an increase. And so it has effect. If you look at the economy, some people are now saying, okay, because people stay home and they got some money, now people do not want to return to work. So it has had a negative impact generally, so on disease, on health, yeah, but maybe Dr. Marie can throw more light on that.
Yeah, before Dr. Marie comes in to throw light on that, I just want to get back a bit to my third question that I should have asked before this, because if COVID-19 created such a huge impact, on the world in general, as far as health is concerned, I want to find out about the herbal remedies. There are some of our people in the interior areas, they most of the time say, listen, all these things people talk about, the bring vaccines, we can use our herbs and we can treat them. How effective are herbal medicines that many times our people sought them for health remedies?
Now, when it comes to Liberia, what is being used in Liberia, I really don't know about it. I must admit, but let me come back to home remedy. Some people have home remedy that steaming yourself using Vicks. It does not cure. It may alleviate the symptoms, right? But it does not cure. No, so people, because your symptoms maybe are alleviated, people have come and say, when you steam yourself, you add this, it cures it. No, it does not. It does not. It alleviates the symptoms. Like if you steam yourself and it improve your breathing, but that's not a cure. Now, when it comes to herbal remedy, I'm looking at the NHR website. They are looking at international, not Liberia level now. They're looking at, I think, 5 plants. They are still on investigation, and if one of those 5 plants could, and the word is could, provide some benefits. So WHO is looking at 5 plants. Now, I don't know which the names, when it comes to Liberia, those remedies, heard, there's no scientific proof, so I would not encourage anyone to do that. The home remedy, you have to be caution, but the best effect is to wear your mask, distance yourself up to now, and get vaccinated.
So the herbal medicinal things that people go for, our traditional people usually go for. What do they pose health risk to the people who are consuming them?
Exactly, could be, again, I'll use the word could be, because it's not measured. You know, you talk about dose effect. It's not measured. So I mean, and don't forget, your liver detoxifies a lot of drugs that go through the body, right? So if that herb, if it's not quantified, you know, you have to, then it could be, instead of providing benefits, it could be very toxic toward the body. So the point is, because it's not under control, there's no control over how much of that herb you're ingesting, you know, what you think would be beneficial, it can end up being very toxic to the body. And that's where we need not to encourage the use of herbal treatment, because honestly, it can be very toxic. I've seen people that use some herb and it went into liver failure. For this, what we call in Liberia the secretory root. It became very toxic to the liver. So you have to be very careful with those herbal remedies that people use.
Dr. Mari, let me get your view on the impact of COVID-19 on the world in general, as far as health is concerned. What health impact has COVID had on the world?
Well, there's been a lot of negative impact. Lot of isolation, depression, other mental health issues, increased substance abuse, suicide. There's been a tremendous increase in violent crimes, including rape and murder. All over the world, there has been a tremendous worsening of poverty. Because, you know, workplaces were closed down. People couldn't go out. They don't have their daily hustle to eat. So much more poverty, more people that are homeless, increased hunger. Some businesses, you know, you can only stay closed so long, and then your business is just finished. More domestic violence. And, you know, there have been pandemics in the world before. You know, we had the Spanish flu in 1918, 1919. We had the plague in Europe, you know, in the Middle Ages. But this one is unique in that there's been so much misinformation and conspiracy theories, and people became anti-science and anti-medicine, and they believe, you know, that like if you get the vaccine, you're going to become magnetic, and things that are actually ridiculous, but they're presented by these people in such a way that some people believe them. And I think that has caused a problem that's going to affect our society for a generation, because every time we have a new vaccine or a new treatment or something that's been very well researched, there are going to be a certain group of people that say, oh, I don't know, I don't trust that, they're just trying to poison us, which is not true. One thing that I do think has been good in this pandemic is it's made us all aware of certain things that we should be doing all the time that we haven't, like washing our hands regularly, don't touch our face, keep our distance from people we don't know, you know, just that avoiding contact with other people's germs, basically.
Right. Let me hear from Pastor Kamara here before I hear from Mr. Atto. I just want to find out from you, Pastor Kamara, what impact has the pandemic had on society? You are a social worker, as an educator, of course, you're a social worker, like the health workers also, they are social workers, we're going to deal with people daily. What impact? What can you say? If you look around you and tell me what impact has the virus, you know, caused on society in general?
Well, a lot. Dr. Marie talked about the psychological aspect of it, depression, stress, anxiety. All of these things were, it just brought up alarming increase in it was already there, but the COVID just, increased the whole problem for a lot of people in the US and over here. Besides the psychological, let me just touch on even politics. It affected our politics. In America, for example, COVID, I started paying attention to politics in America really during the COVID time, and I saw the division that it brought, the disinformation that it brought, and that led to a whole lot of political upheaval. And that is where, for me, COVID was really disruptive.
And then just to add to that, also I want to add two other questions to it quickly before I hear from Mr. Atto. COVID also, shut down, many people would say shut down transportation between counties and from neighboring countries, impact food supply in Liberia. How so? How did they do it?
Well, they could not get the goods, demand and supply.
But transportation, I don't, transportation, how would transportation shut down? Because these are engines that are moving from one place to another.
People were home. They stayed home. They were not using the transportation services any longer. For example, they mandate people, quarantine people at home, people staying at home. Well,
so you don't have any business doing around.
What are you going to do out there? Okay, so people were home.
So commercial drivers got affected.
Even your own vehicle, you had to use your own vehicle at that time. I had my own car. I have my car, but I had to drive my own car because I was home. So much more transportation system. So the transportation system were also affected in that regard. Okay.
Let's look at food supply.
Oh my
For
God.
example, you run, a preparatory school, and you provide something in the morning for breakfast and other things for the kids. If the school was in progress and the kids were in school, how would you have managed to generate to find the food, whatever means to bring the food on the campus that students will have access to the food they usually have in the morning?
Well, let's just thank God that vaccines came in the right time. Let's assume that if there was no vaccine for this viral, we would have had a very serious problem, especially the food aspect you talk. How would people go and produce food? They have to get out, but they were indoor. How would they get out to go and find the food to bring it to the market and then for us to go and buy? So the demand and supply area there was also affected.
I tell you, but Mr. Atto, quickly, I just want to ask you this. So maybe you can go back to, if you don't mind, weighing on the two other questions I asked, Pastor Kamara. But I want to ask you specifically, how has COVID-19 impacted the environment? In addition to that, has it increased pollution or decreased pollution amongst us?
Oh, thank you, Matthias. So, thank you, Matthias. COVID has exposed the vulnerability in our health system, our transportation system, and everything out there. I want us to pay keen attention to some of the services that were affected. I want us to pay in healthcare.
Mr. Atto, there's a feedback. We're getting a feedback from your end, sir.
I don't know whether it's mine.
Yeah, we're getting a feedback. Would you mind checking it, please? Well, I think it's much better. You can try that.
Is it better?
I think so.
Okay. I got off the Bluetooth. All right. So, for preventable vaccine, diseases that were out there.
There's an echo that's coming. There's an echo that's coming, sir. your voice is coming in splitted, and we barely understand what you're trying to say, sir.
Is it better now?
Yes, it's better. Go
Is
ahead.
it better?
Yes, it's better now. Make your point,
Oh,
sir.
okay.
Yeah.
So I was saying that childhood sicknesses and diseases that were preventable by vaccines have been overlooked. People were afraid to go to the hospital. They did not take their kids to the hospital. So we might see a surge of other childhood diseases, which happens. But we need to encourage people to go to the hospitals because they got afraid of going to the hospital before they get COVID. And another aspect was for regular diseases and disability. Yeah.
Okay. Well, yes.
Yeah.
Yes. Go ahead, Mr. Atto.
Okay. Sorry.
So
Yeah,
basic.
so
No, I get. Yeah, go ahead. Let's just sum it up quickly so we can engage the public, because I just want to inform the public there that you two will have an opportunity to tell us what your experience was, regarding during the COVID-19 pandemic, the heat of the COVID-19 pandemic. What do you think was your right denied at any point in time, or were your rights denied at any point in time? Did you feel like you were being caged? Did you feel like you were being denied access to certain things? What can you remember about COVID-19? Go ahead, Mr. Atto.
Yeah, okay. So I'll continue with my previous answer.
Right.
So we have increase in other diseases like diabetes and high blood pressure and other chronic diseases around the world, even in Liberia, because people were not doing their regular checkups. So that's another thing that vulnerability that we had. People had some other issues that came about, but one good thing is that the environment, sometimes I like to look at the good in everything, even if it is a bad thing. Our environment surprisingly benefited a little bit. There were decrease in pollutants. So issues at a factory closed down, so they were not pumping pollutants into the air. Our air got better. Respiratory sicknesses reduced, but so that was one good thing. And another good thing I saw with that too was the increase in online education and online businesses. So I always like to look at some of the good things, even though it is the mostly unfavorable incidents or unfavorable things that are happening. But those are some of the benefits that we took up from the COVID. And I'll just send it over to you guys.
Right.
See if we can get some questions.
I know. Quickly. So before that, let me just hear from all of you generally, the environment that you mentioned about the environment. Of course, the environment was polluted. Many times people just, pour out garbage all over the place.
Yeah.
You want to weigh in on the environment and the pollution in general?
Yeah. So when it comes to pollution, we had an increase in domestic pollutants, even though there was a decrease on factory. So people put the trash out in the street. There were feces dumped out into the street, and we had, when it rains, there's a tendency that some of these will run down into our water supply. Right. So there's no way, is there no win-win situation? It's just you just get the best of what you have. So right. We have our environment being affected too. Thank you.
You're listening to Case of Awareness on Sky 107.1. We are here every first and third Fridays in a month with a repeat the following Sunday from 10:15 to 11:15. The program is brought to you by the Kingdom Innovation School of Science in collaboration with Blessed Kids International. Our panelists, 3, are there in the United States joining us via Zoom to tell us, we're talking about the effect of COVID-19 on society and education in general. Call us in the numbers 0777 777 107, 0777 777 107, 0777 221 223. You too can share with us your own experience about COVID. What lesson, positive lesson, is COVID living with you? What negative lesson, what negative impact is COVID living with you, or it has left with you, so far? Because we I don't know whether we have up to 50 cases here in Liberia right now, but I think it has subsided to a certain level that we're doing things normally now. Passengers are still, taxi drivers are still taking 3 at the bike. Even though some of them sometimes try to say, well, if I take 3, I'm going to increase the transportation fare. But they're still taking 3, respecting the Ministry of Transport. But let's hear you too, the public. Call us on those numbers 0777 777 107, 0777 221 223, 0777 777 107, 0777 221 223 are the numbers you can call us on to participate on the program. This is Case Health Awareness. If you're following us live online, the numbers are also pinned on the screen there, and you can join the conversation. But Dr. Mr. Kamara, I just want to find out, Pastor Kamara, find out from you quickly. Education in general, as a nation, or the world in general, got to some extent maybe affected by this COVID-19 as far as education is concerned. You earlier on weigh in on that, and thing. But I just want to find out what methods or method that you use, as a school administrator. Maybe some other school administrators out there can weigh on that you employ in ensuring that your kids at the school got the education required.
Thank you. That's another very beautiful question. When I came in, realizing that we are being hit by 2 epidemic, the COVID-19 1 and COVID-19 2, I would call it. What happened was that one of the things that I experienced was that the kids were far behind in their instructional time. So what we did was that we increased the instructional time, hire additional teacher to help them increase that. But again, what happened was that we realized that their age, because we are running our early learning institution, because of COVID-19, some of them sat home for 2 years without any access to education. So when they came back to school, their ages were, they were
elevated a bit.
Their ages are gone up. Okay, those who were 5 years old when they came, they are now 7 years old in nursery. We can't have a 7-year-old in nursery. So what we did, we introduced our accelerator program, okay, to get them to their age, because that's one of the policy of the school and philosophy of the school, to have the kids moving along in their education with their ages, because educational psychology says that if the child is over age, or if you will, having a higher age and less grade, there's a high chances of that child dropping out when they reach by 11th grade and what have you. This is why you have a lot of dropout students around. So we are trying to set this example. So COVID-19 affected all of that. And so we try to get those things in place. And as we stand around, this is what I believe some educational institutions should also adapt. They should look at it.
Right. Now, let me just quickly read out some comments here. Darius says here, yes, I like the program. Daleni Kamara Brown Passaway says, yes, COVID-19 has affected so many people and in so many varieties of ways, in so many ways, according to Daleni Kamara Brown Passaway. Thank you, Daleni. But Dr. Passaway, let me get to you quickly. Though you're a doctor, but let's talk about education. I think the last few questions I have here are basically about education, the impact of COVID-19 on education and all of that. And so let's look at it generally. You were in a hospital. You always been there, saving lives and helping people to regain strength in the health area. We have 9 minutes to go, by the way. What can you say about what you observe about the impact of COVID-19 on education in general.
Good. Okay, so that's a very good question because I teach at a community college where we involved in the nursing program, the medical assistant program, and skills. So when COVID came, it impacted our on-site learning. Right now we could not meet, and even though we could teach online, but then the issue of skills became a challenge. How do we provide adequate skills, competencies for them to go out to the clinic? So yes, that was a really challenge. It was really challenging. So we went to Teams so we could continue the lecture, but the challenge became, how can we provide? So we're so happy for the vaccine. The vaccine provided us an opportunity that we could meet, not in a crowded area. We had to reduce the number of people that could meet in the skilled room to 2 persons. We had to observe distancing, wear our masks. But had not been for the vaccine, the impact of education, especially for those of us that teaching skills, it would have been worse. It would have been worse. So the vaccine afforded us the opportunity,
right?
And plus the wear your mask, distancing, the number of persons that be in the room. Honestly, that was a life-saving. It was really, really. But yes, education got impacted. There are some students who could not learn online. Their style of learning. Okay, so going online for some students, it didn't meet that style of learning.
Right.
So some students was impacted. Some students dropped out of school because it was not that style of learning. So we saw some students drop out of school, but once they got vaccinated and the school resumed, right? They came up and that's why our school now has a blended approach. And I love that it's a blended approach. So you have an on-site and an online push. So that way you are able to meet. So we meet less in person and we do all our skills in person, but most of the lecture is done online.
Already,
it's a blended approach.
Right. Already, Dr. Passaway, we had a series of issues with Liberia's education system, prior to the coming of COVID-19. Now that is gradually subsiding, what can we do to help improve the education sector of the country moving forward? What do you think?
Well, on a very serious note, not a bit political, I think there's a need for an investment. Government needs to make investment in the education system.
And just to add, the sub-region, Mr. Dr. Passaway, the sub-region, like Sierra Leone, is investing 20% of its budget, towards education. I think Liberia, we're somewhere around, maybe we're not even up to 13% of our budget.
I don't think
it's not even going towards education. So if you talk about investment, I actually agree more.
I think it's 3%.
Yeah, 3%, thereabout, 3 or 4%. Which is very infinitesimal to the need in enhancing the education of this country. But just go ahead, sir, make a point.
So, again, we go to scripture. Bible says, where your treasure is, right, there where your heart will be. So if we want to really improve education, not empty mouth, we have to speak for what our investment. And must start with the government taking the lead. We have to invest in healthcare. In education and healthcare. If we must improve the country, we should start with healthcare and education. Honestly, until we make serious investments in those 2 areas, I'm not going to be pessimistic, but we have a long haul. So we need to look at the education system, bring in experts. I'm not criticizing it now, I'm not saying no, but we need to look at it, take a view and say, okay, what is the way forward? Now you have a lot of we got a lot of people on YouTube that can enhance our education, right? No joke. You go on YouTube, you got a lot of educational material, but how do we utilize that at the very level in our education system? And that's where the investment comes from. Bringing Liberians, not for real, bringing Liberians, experts, we sit down, we look at the health system. What is the way forward? Investment, and commitment.
Thank you so much. I want to go across the table around now, so that since we joined the curtains already, we have 5 minutes to go. Let me begin with you, Pastor Kamara, right in studio. What is COVID-19 leaving with us? Negative impact, positive impact, or lessons?
Well, it depends on who you're going to ask this question. But generally, I would say that of our society, like Dr. Barker said, not to be political, we have to come back home and ask ourselves, what COVID left with us, and how can we improve our lives as a result of COVID? But from my area of expertise, I'm from the educational sector. There is no way any country or any society, any environment, any community can ever improve their well-being without education. There's no way. I don't see it. I don't see any other way. We can do all the investment we want, but when there is no bottom line education, we are doomed for failure.
Let's hear from you, Mr. Arthur, quickly. What do you think? What is COVID-19 leaving? What did COVID-19 leave with us? I don't know whether he has left completely, but I know some, yes, they will still have some effect here. But what is COVID-19 leaving with us? Positive lesson or negative lessons?
As I said earlier, COVID has exposed our vulnerability, and we need to work on those. I'm mostly interested in the educational aspect, and I think we need serious commitment in resources and finance to educate our people, and making provisions for teacher education is very important. Our teachers need to be upgraded and trained, because when they are not trained, they will not be able to train the students. So we found out that COVID has exposed that. So the good thing is that for us to prepare ourselves and step up our game, and ensure that children go to school. Like when COVID came, school were closed down, but half of the students did not return to school. Some of them could not afford to come back to school. Some of them could not get the resources, get the capables, get whatever was necessary for them to return to school. So we need to make sure that students can return to school. That's the only way we can help our people.
Okay. Thank you. Yeah. Thank you so much, Mr. Arthur. And that's all the time we have with you. But let's hear you, Mr. Dr. Passaway, briefly in 30 seconds. Just wrap up.
I mean, all that being said, I want to thank you, Matthias, and the public. COVID is not going away. We still need to take necessary precaution, wear masks, wash our hands. The cheapest way to prevent infection is to wash your hands.
Okay. Thank you. Dr. Mari, 30 seconds.
Dr. Passaway said it so perfectly. Be aware, take care of proper hygiene practices. Wash your hands, wash your hands, wash your hands. And remember that throughout the history of the world, the key to exiting poverty is education.
Yep.
So we must put education first.
Yep.
Absolutely. We must make education our number one priority. And that's all the time we have for today's edition of the program KSF Awareness on Sky 107.1. KSF Awareness is brought to you by the Kingdom Innovation School of Science in collaboration with Blessed Kids International. We are here every first and third Fridays in the month of a repeat the following Sunday from 10:15 to 11:15. I was here today, always with my panelists, the usual panelists, Dr. Boakai, Dr. G. Boakai Passaway, Dr. Mari Brookfield, Mr. Daniel Atto, Pastor Samuel Kamara, and myself, Matthias Labindi. That's all the time we have for today. Join us on Sunday from 10:15 for a repeat of this program. Have yourselves a wonderful weekend.